Let's discuss the red flags of feeding and what to watch for in your baby.
Speech language pathologist. In today's presentation, we will be discussing what to watch for in your infant that may indicate a feeding challenge. We won't discuss how to fix these feeding challenges, but rather empower you to recognize when there is a problem and then next steps that you can take to address that.
First, I want to say thank you to our friends at Early Learning Indiana. They have given us this opportunity to present this information to you. Thank you so much. A quick disclaimer as well. The information that you will hear in this video is not meant for medical advice. If you have concerns, please consult your baby's pediatrician. Your pediatrician and you know your baby best.
Before we can discuss what indicates a feeding problem, let's first discuss what a good feeding would look like. We want your baby to be calm with an organized sucking and swallowing pattern. As they draw the milk in from the bottle, we want them to swallow and then briefly pause to take a breath. We want your baby to be relaxed and calm with no tension in their body. That feeding shouldn't take over a half an hour. Baby starts to work too hard if that feeding is long. And at the end of the feed, we want your baby to appear that they are satisfied and ready to play or sleep.
When is feeding considered a problem? Feeding should not be stressful for you or your baby. When it is, there is likely an underlying issue that's causing that stress. So let's talk about some things that can indicate a feeding problem. Growth and intake concerns, difficulty coordinating the suck, swallow, breathe pattern, signs of aspiration, behavioral and stress cues, and or oral motor difficulties. Let's further discuss each of these topics. You may have growth and intake concerns, so how well your baby is growing and how much they are eating each day. You may hear from your doctor that your baby has poor weight gain or even weight loss. Your baby's feeding may be taking longer than a half an hour to even finish a feed. Your baby may fall asleep quickly or only feed while they are asleep, and they may need to eat more often as they are not able to finish a full feeding. Your baby may have difficulty coordinating the suck, swallow, breathe pattern in order to safely feed. The suck, swallow, breathe pattern is when baby sucks on the nipple to draw in the milk, swallows the milk safely, and takes a brief pause to breathe. This pattern occurs again and again throughout the entirety of the feed. And when a baby cannot coordinate the movement, they may demonstrate coughing, choking, or gagging. They may frequently pause to catch up with their breathing. They may have noisy breathing, so their breath sounds may sound wet. Baby may have color changes, appearing pale or red around the eyes, and or you may see milk that leaks out from the sides of their mouth as they feed. Your baby may also show signs of aspiration. Aspiration is when your baby's milk goes into their airway and lungs rather than into their tummy. Your baby may present with coughing during or after a feeding. They may have a wet or raspy voice when they cry after feeds. They may have recurrent respiratory infections such as pneumonia or congestion that worsens after they feed. You may also notice watery eyes during or after a feeding. Your baby may demonstrate behavioral and stress cues during feeding. This looks like arching their back or becoming stiff, crying or refusing feeds, turning their head away or pushing the bottle or breast away, fussiness that escalates during a feeding, or signs of distress such as finger splaying which is when they spread their fingers out in a tense way. If baby shows stress cues, it likely indicates that they are feeling stressed around feeding, and there's more that we need to look at to determine why that's happening. Your baby may also demonstrate oral motor difficulties, making feeding challenging. They may have a weak or uncoordinated suck to the nipple of the bottle. You may hear that baby clicks as they suck on the nipple, which indicates that they have difficulty maintaining that latch to the nipple, which in turn will result in poor feeding. We have discussed the red flags for feeding when it comes to taking the bottle. Let's briefly discuss some red flags when it comes to working towards purees and solids as your baby gets older. So some indications that there may be a feeding difficulty could be refusal of new textures and foods, coughing, choking, gagging on foods, not chewing foods. So your little one may hold foods in their cheeks, they may spit food back out and or swallow food whole. They may have difficulty learning to use a straw or a cup system close to that year mark as they transition off the bottle. They may also simply just become very upset each time you try to introduce new foods.
If you feel that your baby does have feeding challenges, the next steps would be to speak with your baby's doctor. Your baby's doctor may refer you for a feeding evaluation completed either by a speech pathologist or an occupational therapist. Either one of these will evaluate your baby by watching them feed and helping to define what is causing problems for your baby when it comes to feeding. They will help you implement strategies that will assist your baby with feeding better. I hope that this presentation has empowered you to recognize when there is a problem and to encourage you to seek out additional services if needed.